Good morning, everyone. I'm really happy to be here to talk about such an important topic, transforming health through innovation. In the next 30 minutes, close to Dr. Chao, with whom I have already had the honor of being in other debates, and Victor, um, new business development for Roche Diagnostics. And before anything, I would like to thank Josie and Rodrigo for the invitation, and I would like to praise them for this wonderful conference that they have organized. So, starting our debate, and there will be others, I would like uh, our speakers to give their vision of what they find important for this topic, transforming health through innovation. And in this manner, I would like to see if Dr. Chao could go first and start our conversation, sharing a little bit of what he thinks of how we can transform health through innovation. So, initially, good morning, everyone. Good morning, Fabrício. Good morning, Vitor. And I would like to praise Josie and Rodrigo for the initiative of organizing this conference and for the invitation. My vision is to provoke a disruption today. Today, the healthcare system is very much concentrated exclusively in dealing with the disease, in managing the disease. I need that on this decade, we need to focus on telehealth of biopsychosocial approach, where we are going to manage lifestyle and quality of life. Probably this will be a decade in which the center of healthcare in the hospitals, we are going to go through a phase where we call distributed health, which is very much related to hyperconnectivity and artificial intelligence in people's homes. So probably we are going to go into the concept of connected health managed by the hospital as a quality hub. COVID has taught us two very important things. Prevention and maintenance of health is vital, so that if you get sick, you have a more higher functional reserve. Number two, hospitals are places of excellence, but you should only go there when you need. Otherwise, it is an environment where there's risk of contagion. So this I call 5.0 connected health with lifestyle management, and this approach of interaction that we are going to look after the well-being of people, and we are going to work with a combination of interactive digital means. Fabrício, the floor is back to you. Excellent. So this is a vision of transforming the focus of looking after the disease, but focusing on looking after health is very interesting. And I agree that this new decade, this needs to be the focus. And Victor, what can you tell us about that, about these initial thoughts? First of all, thank you all very much, and especially FIS, for the opportunity of talking about health and innovation. This is very much in Roche's innovation, and it's an honor to be talking in the same panel as Dr. Chao and Fabrício. In our opinion, transformation through innovation in health starts an integration of care, and then we focus on three pillars: better outcomes for patients, better experience, always patient-centered, reduction of total costs in health, and sustainability of the healthcare system for all players in the system and all stakeholders too. And very importantly, we should have a vision going from diagnosis and prevention, as Dr. Chao mentioned, all the way to treatment. And more we see that along the way of personalized medicine, individual treatment, and it will provide cost reduction and better care for patients. And another very important focus is how to change innovation in care providing models. And so in these service models, you can have incremental innovation, disruptive innovation, radical innovation, or architectural innovation. And it is based on performance and more related to collaboration, also patient outcomes, and based on value, based on the impact on the new models, payment models. And then what we have been discussing here, and when we talk about services, we are not thinking about marketing and 4P, and we have a new 4P that starts with patient, healthcare workers, providers, and payers. So everything needs to be connected, and it needs to make sense for all players in the system. And then you need to have a good mathematics, a good calculation, and a good balance between the costs, and I can make innovation. If it doesn't get to everyone, it won't be feasible. So I think of the private, but also about the public healthcare system and access, because there's total cost too. And I always need to think about society and the impact that innovation will have. Innovation is not valid once it increases costs. So initially there is a bigger investment, but in the long term it should reduce total costs for the healthcare system as a whole. This is the initial vision for us to start this conversation. Thank you very much. Excellent. So if we think how it was 10 years ago, they were major offenders of healthcare costs and contributed to medical inflation. And I think that research and development, that the industry and other players invest into, has driven to the innovation today that is focused on sustainability, productivity gains, and complete change. So innovation 10 years ago was higher cost increase, and today is productivity gain and more contribution for the sustainability of the whole industry. Dr. Chao, I would like to ask you about your expertise in the area of virtual healthcare. You mentioned that hospitals will become hubs for the promotion of health. Another major trend that we see, dehospitalization of services that need to be delivered wherever patients are. Can you tell us a little bit, in your vision, how can innovation enable and make it possible for patients to receive health care wherever they find best for them? Well, in essence, I'm going to divide this into two categories. First are the intelligent homes and intelligently flexible, because we mustn't forget that on this decade, the main feature is called aging. Until 2030, Brazil will be the 5th oldest country in the world. So we need to work with intelligently intelligent homes, because there will be artificial intelligence with a person, and then we will need to deal with health supervised at a distance, and hospitals will use a logistic system of intervention if necessary. So this is the first point, and this can be a home or the buildings or homes that would be adapted for this increase in efficiency in the care chain. Medical treatment just with prescription without compliance doesn't work. So I defend reducing patients and increasing stakeholders. People will be co-responsible, and therefore we need to promote efficient co-participation using this technique of connected homes that will become healthcare units in synchrony with hospitals. The other thing is the advance of wearables. So we will have not just homes, but also wearables in the area of innovation that will facilitate continuous monitoring. And just to remind you, monitoring. It doesn't mean controlling anyone. After all, we have the General Data Protection Regulation. This is called supervision under demand and a development of a policy that 5 or 6 years before we will definitely have a quality of life improvement program. For example, an elderly person we could interfere after 50 or 55 years of age, changing lifestyles. And precisely the medication and the good quality research that we are monitoring in a connected way to provide care so that we have pharmacosurveillance, adverse events, so we have a combination in the entire process for change through health. Dr. Chao, this change in paradigm that you have mentioned now, that the population as a whole needs to stop being passive with regards to their health. They need to contribute in terms of looking after health, to become leaders of their healthcare. And I'm sure the digital transformation will provide new methods for the engagement of patients that will make it possible to provide significant improvements in care, especially for chronic diseases. And I think that another aspect regarding the wearables, and they may transform the management of population just out of curiosity. With COVID-19, we saw the pursuit of pulse oximeters in order to be able to measure. And interesting, my watch here measures automatically that all the time. So this shows how advanced wearables are and how far they've come. And Victor, another very important agenda for this decade is the fact that collaboration between artificial intelligence and physicians and healthcare workers will be fundamental for higher productivity. As Antonieva used to say, machines will not replace doctors, but doctors will need to use artificial intelligence and will differentiate themselves against those who do not use. How do you see this man-machine relationship in the area of diagnosis? This is already a reality.
When we consider the diagnosis, it influences 70% of the clinical decisions. And we can have access to digital tools and clinical decision-making tools. We are in contact with startups, both in Brazil and abroad. There is one which is really interesting, a robot on artificial intelligence. So within 4 hours, and we know whether the person will go into clinical worsening and sepsis. There is one client which is already interested in having it implemented. It's being now finally discussed. And this is the reality. The pandemic has really sped up a number of processes of artificial intelligence, trying to understand how to maximize treatment and prevention. From our opinion in diagnosis, it's part of our strategy tripod. So digital solutions, without artificial intelligence, that it's going to help decision making, and also management of chronic patients. So something absolutely essential, and we've been considering about reimbursement. This is something that has been done in Germany, and it's going to be a very important discussion for us in Brazil within this concept of innovation, bringing it to INS and the public healthcare system. Great. Based on what you've said, we still see in Europe and in the United States regular authorities see that a recent case, Medicaid, Medicare, announced that they are going to start reimbursing a digital app through the complications of diabetes in the retina, paying $20 per patient, and another app monitoring complications related to stroke. This is going to be a landmark showing the advance of artificial intelligence and innovation. How do you think that reimbursement, appropriate reimbursement, will be essential for the systems to get better organized, considering all the technology that is going to provide the best results to the system and to the patients? We have a piece of legislation that provides that. It's called Law of Telemedicine. Assistance to research, prevention of diseases and risk, and health promotion. So reimbursement, it's part of the strategy to reduce worsening. I think we should all be together to concentrate on the transformation, considering lifestyle, promoting health, but above all, we have to reduce risks and worsening and events, and this is part of the legislation today. Excellent, thank you. Vitor, is there any case, a fully implemented case in Brazil or globally that would lever these innovations to promote what you have? We had the classical triad: people, technology, and processes. And now we also have data. Within the lab, or the clinical perspective, especially concerning lab analysis, we all have analytics and artificial intelligence. The focus has been on better using the system. Decision-making support to be shared with the physicians, knowing what is the best test to be ordered and applied. This is something already in place in Brazil. The innovation is going to be implemented next week. We are working on innovation, efficiency. It's going to improve the impact on the patients, especially in the private healthcare system. And there are many examples of our clients, labs that work in private and public systems. What really matters the most to us is to have sustainability. We've been experiencing the importance of having a healthy provider, a healthier payer, and above all, patients should receive the best care. What has happened with telemedicine has helped us, especially what we've observed in recent months. We have really progressed in terms of implementation of new digital technology. And we are going to do it all in the upcoming years. So we are going from a difficult situation to doing something much more positive to the Brazilian healthcare system. Innovation is part of a reality. Great, really great. Amazing. Time flies, and we are getting to the end of our interaction. I'm going to ask Dr. Chao Wang to make his closing remarks. Thank you very much for your moderation, Fabrício. I think that the main issue today is that we have to build telehealth with biopsychosocial care, trying to develop the whole healthcare chain. And we should never forget the intelligent or smart technology to deliver better health to people. Victor, would you like to make your closing remarks? Well, I'd like to thank Fabrício, Chao. It will be all based on care integration. The more we integrate the patient within their homes into the system, the better. And it has really helped in terms of care. I'm very optimistic, and I believe we are on the right path. Thank you very much. To close, I would like to quote Bob Iger, a former Disney CEO. He said that in the 70s he learned that the most important thing is to be constantly innovating so that you don't lose relevance. This is something very updated, and the sentence he used to say, innovate or die, it's a reality to all of us. With that, I thank you, Dr. Chao, Victor, Josier, and Rodrigo. Thank you all very much. Have a good day.